Hey, let's talk a little bit more about insertional peroneal brevis tendinopathy and some of that lateral band plantar fasciitis, two really common conditions that I see. Now, positioning of the patient, typically I'll just have them laying in, on the seat normally. We might just turn that foot in for our, sural nerve, and then turn the foot out as we start to get some of that tibial nerve, that lateral band of the plantar fascia. Now, my typical approach really is having a good feel around. Often these patients are quite sensitive over to that styloid area, but really we're just wanting to come just a little bit off it and, think about half centimetre, a centimetre off. Make sure, and sometimes I'll do this a little bit deeper into this area. And then as we're coming up that sural nerve, starting to get to some of our bifurcations. Not always are these tender, and sometimes we might even be coming up into our superficial peroneal, because we do know there is a bit of a communicating nerve in that area. But typically we're just going to be following that sural nerve up as we get up into that lower leg. Now, let's not forget that sometimes we do get, the lateral band plantar fasciitis at the same time. And so rather than sort of hitting it underneath, which can be a little bit more tender, let's start targeting that tibial nerve and, particularly that lateral plantar nerve as it's starting to come from, that Baxter's nerve sort of junction and then coming up from there. Now, there's quite a few different ways, that we can, or different levels that we can approach that. And so, just see which ones are sensitive and, sometimes they won't at all be. For our typical peroneal brevis tendinopathy though, let's stay on the lateral side. Now, most patients do respond quite well. Most patients will have a 50 to 70% reduction in pain within that sort of, 10 minutes after the session, and then that 70 to 90% reduction in pain by the next day. Of course, only going to last potentially that 3 to 5 days, but typically these patients do respond quite well. Once we desensitize, we can then start putting our strengthening into place. Now, of course, I, put a fair bit of hyperfix on my patients, a nice stirrup, and in this case, we're going to be pulling them into sort of a pronated foot type to unload that styloid process. I also find a bit of a cuboid notch on their orthotics or their inner sole is just going to be really nice for a symptomatic relief. But let's not forget our strengthening, whether we want to look at some laser therapy or some platelet-rich plasma. All of these are an option. Now, as far as when we talk about patient tolerance, definitely around that styloid process, patients are going to find that it's quite tender, but as we come up, it's pretty well right. I sort of say, let's get these two worst ones out of the way, being sort of on the styloid process and just back on that peroneal brevis, and then after that, people are pretty comfortable as we go through it. A little bit of short-term pain for long-term gain. But this is insertional peroneal brevis tendinopathy and that lateral band plantar fasciitis. Cheers.